Welcome to tonight's webinar. My name is Maureen Martin, and I am a Programs Manager for CAN-DO Multiple Sclerosis. Thank you for acting on the belief that you are more than your MS by attending tonight's webinar, Choosing Alternate Therapies to Complement Prescribed Medication. I want to start tonight's presentation by talking a little bit about CAN-DO Multiple Sclerosis. CAN-DO MS is an innovative provider of lifestyle empowerment programs for people with MS and their support partners. We are the start of a whole new way of thinking about and living with MS. A national nonprofit organization, we empower people to move beyond their MS by giving them the knowledge, skills, tools, and confidence to adopt healthy lifestyle behaviors, actively co-manage their disease, and live their best lives. Our renowned programs have helped thousands of people with MS reclaim their dignity, control, and freedom, and transform their challenges into possibilities. CAN-DO MS launched our new website last summer, www.mscando.org. Please visit the website where you can register for upcoming webinars, listen to archived webinars, check out our upcoming CAN-DO MS lifestyle empowerment programs, share your CAN-DO promise, and learn ways you can contribute to or get involved with CAN-DO MS. Just a few housekeeping items before we get started. Jennifer Smirka will address questions and comments at the end of the presentation, and we encourage questions and comments throughout the presentation. To ask a question, you type your question in the chat feature that's located on the left of your computer screen. So you should see a box on the left side of your computer screen that says chat. So to submit a question, just type in the small box that says chat with presenters. This presentation is being recorded and will be archived on CAN-DO MS's website. You're more than welcome to view the presentation again, and if you missed one of our other webinars, you can find the archived version on the website as well. For those of you who are attending live tonight, you will receive an email tomorrow with copies of this PowerPoint presentation. And as many of you discovered when you logged on to the webinar tonight, new in 2011, you can listen to the live webinar through your computer speakers rather than having to call in. So the job of the live participants tonight is to, number one, submit your questions and comments in the chat box. Number two, complete the evaluation at the end of the webinar. And number three, review the webinar schedule and register for upcoming webinars. So we have a great speaker lined up for tonight's webinar. Jennifer Smirka is a board-certified adult nurse practitioner and board-certified multiple sclerosis specialty nurse. Ms. Smirka received her Bachelor of Science in Nursing at Michigan State University in East Lansing. And she received her Master's of Science Nursing and Nurse Practitioner Certificate at the University of Michigan in Ann Arbor, and has completed preliminary coursework for a doctorate degree in nursing practice at Columbia University. Ms. Smirka has held faculty teaching and clinical positions at the University of North Carolina at Chapel Hill Medical School and Columbia University School of Nursing in New York City. At both academic posts, she was faculty nurse practitioner for the UNC MS Center and the Columbia University Multiple Sclerosis Clinical Care Center. She's exclusively worked in MS since 2003 as a clinician, clinical instructor, consultant, and a clinical research investigator. She's an active member of the International Organization of Multiple Sclerosis Nurses and was elected to be a board member in 2008. She currently has a private clinical practice at the Fort Lauderdale MS Center in South Florida. So before we start tonight's presentation, let's just do a quick survey to get a feel for who's on the webinar with us today. So I just put a survey on the screen, and it asks you to tell us about yourself. Are you a person living with MS, a support partner, a healthcare professional, or other? So we'll give it just a few seconds to let everyone answer the poll. All right. So it looks like we have about 96% is a person living with MS, almost 4% a support partner, and about 4% is other. So it's a great group we have on tonight. And with that, I will turn it over to Jennifer Smirka.
Thank you so much, Maureen, and thank you to all of you for tuning in this evening. I know It is hard to tear yourself away, being that it's Mardi Gras and March Madness and the regular Tuesday night lineup on television. So I hope that you leave here having a little bit more than what you came in with. And I'm really excited to talk about this. It's not meant to be an exhaustive seminar or discussion, but at least hopefully to scratch the surface and to get you thinking more about complementary and alternative medicine in MS, but also to really instigate a dialogue between you and your MS healthcare provider to determine what there may be out there that could be utilized in complement with what you are already taking. So I'm going to go ahead and move ahead here and I just want to see how long our delay is. Okay. So moving into complementary alternative medicine, really the terms are three, and we use alternative meaning, instead of, complementary to use with, and integrative is a more recent approach that Western medical schools are utilizing, really trying to adopt more fields of therapeutic modalities within the conventional kind of therapy realm. I'm going to go back. I think I just skipped a slide here. Okay. So again, alternative, what I mean is it's instead of conventional therapy. And these are therapies that are generally not taught in Western medical schools or are available in hospitals. And unfortunately, because they're non-conventional, they're generally paid out of pocket and not generally covered by insurance. Conventional, on the other hand, are those therapies that are in fact taught in Western medical schools, and they are available in hospitals and widely covered by insurance plans. And these are therapies that we know of, medicine in general, surgery, rehabilitation, psychiatry, and things like physical therapy, occupational therapy, speech therapy, the things that we generally see in our MS centers. And complementary and integrative models are, again, as I said, things that are really used in combination with conventional medications. Now we're seeing many more universities that are utilizing integrative medicine within their medical school curriculum. Probably many of you are familiar with Mehmet Oz, Dr. Oz. He is actually a cardiac surgeon at Columbia University and was one of the first pioneering Western-educated physicians to use touch therapy in his ORs to help patients to actually rehab faster. And many are probably very familiar with Andrew Weil, who is also a Harvard Medical School trained physician who has really brought a lot of light to the forefront about utilizing integrative medications and therapies. We also have a lot of doctors of Oriental medicine and Ayurvedic medicine that are being introduced in Western medical curricula, as well as acupuncture, acupressure, and a lot of massage therapy, which I'm grateful to say that they are starting to be recognized and partially covered by insurance plans. The next slide here is really kind of a pictorial representation of what we try to achieve in an MS center, where we try to utilize all of the conventional medications, the FDA-approved therapies, the therapies that have been rigorously scientifically tested, but then also utilize other modalities that we know provide a benefit to patients as far as quality of life improvement. And as you know, that varies from practitioner to practitioner, but the ideal would be to utilize integrative therapies that have a lot of evidence to support their use with very low risk and hopefully low cost to you. So we utilize complementary and alternative therapies because unfortunately we don't have all the answers. I mean, conventional medicine we know isn't curative at this time, and we want to do everything we can to help promote your well-being and your health. And unfortunately, MS remains a chronic and somewhat progressive disease, and as I said, there's no cure available yet, although we are working very hard at a basic science level to establish a cure. And lest we not forget, as humans, I think at our core we are hopefully optimistic, and with that, sometimes can be a vulnerable population, and so we have to be cautious not to be so gullible or suckered by people who would capitalize on our the unfortunate circumstances that befall you. In my introduction, you saw that I've worked at a couple of different places. I feel like I've worked the entire East Coast, although not quite yet. But I'll tell you, the practices really do differ by different professionals. And there are certainly MS specialists who don't ask you, don't instigate the discussion about utilizing alternative and complementary therapies. And there's others who, unfortunately, won't even discuss it. And some also dismiss it and have a relatively negative opinion and also attitude towards them, while others do discuss, and fortunately there are some that will recommend and actually do research to try to see what opportunities or therapies are out there that may help where our conventional medicines have their limitations. Regardless, it's important that when you choose therapies that we really have to evaluate the evidence. And what I mean by that is looking at the different types of evidence. And we'll go into that in a minute. But looking at what are the risks, what are the costs and the availability. Some of the reasons why healthcare providers may not discuss or won't ask you is one because they don't know themselves. They haven't done the research, and they may not be interested in doing the research. But I still encourage you to ask. We all take an oath to do no harm when we enter into medicine and treating patients. And unfortunately, I think sometimes we get caught by that in that we limit ourselves into looking to see what other therapies or medical modalities are out there. And of course, cost is always a limiting factor. The important thing is when you're looking at evidence, and it is important to actually do an evaluation, there are several different types of evidences that we look at. And the least probably weighted as far as a scientific approach would be anecdotal evidence, and that is based on your own experience. And that's not to say that that's not important. It's just that when you're looking at it in an academic way or a scientific method, scientists by their very nature need to have proof. And so anecdotal evidence, unfortunately, is looked at as somewhat less weighted than scientific proof or laboratory evidence. That's not to say that it's not important, but it does have less weight with most practitioners. Okay, obviously, things that we can see, touch, feel, and measure tend to have a greater weight on the evidence scale, if you will. So things like laboratory evidence and animal evidence generally have more weight even than observational evidence, unless the observation can, of course, be measured. And experimental clinical evidence is probably what we consider the most scientifically rigorous, and that is clinical evidence that's derived from usually placebo-controlled, randomized, double-blinded trials, kind of what we consider the gold standard in academic medical practices. Now, traditional therapies for MS, if they've been FDA approved, they're generally, they've all been through clinical trials, and like I said, the gold standard is for those randomized, placebo-controlled, double-blinded trials that have, prospective primary and secondary outcome measures established before the study, so that it's not post hoc review kind of analysis. Unfortunately, despite that kind of rigorous scientific trial design. Not all the medications, none of them are 100% effective, and unfortunately they're all very expensive, and all have some sort of side effects. And although I'd like to say, generally speaking, when the FDA approves medications, it's because they've been monitored and are considered generally safe. Although we know there are exceptions, unfortunately, to every rule, it is of great importance to us, your safety, when taking any medications. So complementary and alternative medicine therapies for MS is, we really feel in the MS community as healthcare providers that no unconventional therapy should be used instead of conventional therapy. But in fact, we recommend that CAM therapy would provide a convincing level of evidence for its use. And then we evaluate with you the risks and the costs and the effort that would be involved and the previous experiences, and then go from there. And generally speaking, if the risk is low, even without a strong evidence of effectiveness, it might be reasonable to try. Some people, you will get a benefit, and that might be helpful. However, if the risk is high and there's not a lot of strong evidence for the effectiveness, it's generally, we believe, less reasonable to use. And I use the analogy of cancer. So in cancer, if somebody has terminal cancer, we generally are far more aggressive in medical therapies because we know that the disease itself is terminal, okay? And so we might use things under what we call compassionate use and be very aggressive to try to prolong life, even maybe 6 months to a year, okay? However, the paradigm shifts when you look at a disease like multiple sclerosis, where it's generally, people don't die because of MS, but it is a chronic disease, which can be, just as challenging and sufferable. But there is less risk usually involved, utilized with therapies because we don't want to cause the therapy itself to be terminating. So it's looking at the risks versus the benefits and putting them on a scale and working with your healthcare provider to determine what is acceptable to you as an individual. So information sources for complementary and alternative medicine. As I said before, not every healthcare provider will discuss it or recommend it or even is knowledgeable about it, and that really does vary place to place. And it's really the only way to find out is to ask. The other areas, obviously, the Internet. People search the Internet all the time. There's complementary and alternative medicine. There's actually, I'm glad to say there's a lot of papers now being written on PubMed and IBID's database. And in fact, there's actually, the NIH has an exclusive site just for the National Center of Complementary and Alternative Medicine. And I will provide all of those websites. There's a few in our slide deck, but I'll make sure to give it to Maureen so she can disseminate that to you as well so you have those sites. And certainly then the search engines, I mean, if you go on Google or Yahoo, you can pretty much find anything. But do be aware that those public sites, they might be commercially tainted. There are a lot of people who advertise on those sites and certainly may garner more attention depending on how much money they're supplying to the search engines. So to consider sources credible, information that's provided by the MS organization, things that are peer-reviewed, those are considered credible. So the National MS Society actually has a very nice website that actually has a pretty involved area for complementary and alternative medicine. In fact, if you just go to the nationalmssociety.org and type in complementary and alternative medicine, it'll pull you right up to the page. Same with the MS Foundation and the MS Society Association of America. And again, all of those are peer-reviewed. they all have their information based from panels of professionals who have an expertise in MS, and there's information there from academic centers and government public education sources. So they've been all heavily vetted by people who have an acumen in complementary and alternative medicine. So generally what we recommend is that if you're doing some research on the internet, look at the content of the information. And look, I mean, are they requesting that you send them money for more information? Generally speaking, you should be able to get information for free, in my opinion, if it's considered credible. It should be evident and available for everybody. You want to look for evidence that has supporting statements, ideally from some clinical research trials, either to refute or even substantiate somewhat its use. Be careful of claims of a cure or a new discovery or a groundbreaking discovery. Generally, if things are true and are truly making the news, you're going to hear about it in multiple forums, not just in one website or in one advertised area. You're going to see it in the national news coverages. You'll see it on the National MS Society website, the MS Foundation, Can Do MS. I mean, if it's credible, you're going to see it in multiple sources. Just be cautious. If things are too good to be true, they generally are. So let's move into actual, actual complementary and alternative medicine. So, patients do use a lot of herbs and vitamins and supplements. They are easily accessible, although poorly regulated, but widely used. We know there are things that may be beneficial in utilizing these herbs for MS. The first one is St. John's Wort. This has a lot of potential use in treating depression. It's thought to regulate some of the neurohormones that we see with depression, including the dopamine, serotonin, and norepinephrine levels. Be careful not to self-diagnose. This medication will interact with other things. Specifically, ladies, it will interact with birth control. So if you're taking this and you are on birth control, it has a potential of rendering your birth control ineffective. So if you thought you were slightly depressed, you're going to be probably a little bit more with an unplanned pregnancy. So be cautious. It also does have some photosensitivity in that you might be more sensitive to bright light and may have some sedating qualities, okay, which doesn't help if you're already trying to battle fatigue. May be helpful, is certainly less expensive than the prescriptive antidepressants, but discuss it with your healthcare provider. The next one is Ginkgo biloba. This is thought to help with memory. It may have some antiplatelet properties, platelets of course being the components of the blood that help you to form clots. Some Alzheimer's studies did show conflicting evidence whether it helped with cognition and with memory, although we're not dealing with Alzheimer's here, and MS it has nothing like Alzheimer's. There were two conflicting studies showing some effectiveness in MS. One thought that it did have some effect, and the other showed that there wasn't a significant change. It is definitely not effective in treating MS attacks, however, and it does not have, studies that have been done have not shown that there's any benefit or effect on actual disease prevention. Okay? It does have some antioxidant properties, we know that. And in general, antioxidants we think might be beneficial in preventing axonal injury and repairing myelin. And certainly there was some benefit seen in the animal model of MS, which is the EAE model. But I always, tell my patients, well, until you grow a long tail and floppy ears, I think the evidence in mice is compelling, but you are far more evolved than a rodent. So, while it remains somewhat beneficial in rats, I reserve judgment for people. So might be possibly harmful in this respect that antioxidants do stimulate T cells and macrophages. And as we know, MS is an immune-mediated disease where the immune system seems to be overly active in some respects. And so activating it more or stimulating it more may in fact be deleterious as opposed to being actually beneficial. Now, calcium is an interesting supplement in that because a lot of folks, when they have MS relapses, may be treated with some type of steroids. We know steroids can cause some bone depletion. So we do recommend that as an adult, if you've been treated with steroids especially, that you do get a DEXA scan or a bone scan early on to get a baseline, and then follow up over time. When you're younger, probably once every 3 to 4 years. As we get older, and I say maybe over 65, that we're checking it once a year, or over 60 once a year, depending on how much steroids that you've had in your lifetime. But it is important that really all of us should be taking some sort of calcium supplement. You want to be taking at least 1,000 milligrams a day if you're under 50, and about 1,200 to 1,500 a day if you're over 50. And men, discuss this with your healthcare provider. Men do lose bones, their bone density as well, but not to the same rate that women do, especially postmenopausal, because of the effects of the estrogen. But you don't want to be taking as much calcium as women because of the risk of potential risk of prostate cancer. But men after the age of 50, you should be getting a regular prostate checkups. So vitamin D is a very popular supplement and vitamin at the moment. It is a fat-soluble vitamin, and it is about 30 to 60% of the population seems to be at risk for lower levels. And we don't know the cause. It's been speculated it's because we're no longer an agronomous society. We're no longer outside gardening in our backyards, and most of us get up, get in our cars, go to work, are inside most of the day, and then get back into our car, go back into our garage, shut the door, and really get no sunlight. Might be related to the fact that if we do go outside, we're slathered up in sunscreen. Or if we're obese, that vitamin D is locked up in the fat cells because it is fat soluble. Or maybe it's because of some of the medications you might be taking. Not entirely sure. We do know that vitamin D does seem to inhibit the immune system, which would be helpful in a disease like MS. And there has been some very compelling evidence coming out of a couple of studies that have been done looking at MS relapse rates with vitamin D levels and correlating the fact that when you have lower levels of vitamin D, there was a tendency in one study out of Australia that people had more relapse rates over a 2-year period than those who had higher levels of vitamin D. And also in children, those who have higher levels of vitamin D have a lower risk of developing MS. It is of interest. I mean, children don't play, generally speaking, outside as much as they used to. And we know that there is, when you look at epidemiology studies, that the further we get from the equator, the greater the preponderance of cases of MS do occur. So I think it's not illogical to suspect that there's definitely environmental factors at play here. So we do recommend getting tested, and the level, the blood test is a vitamin D 25 hydroxy level that should be done. And of interest, I started checking these in my practice in Florida, and about a year ago. And it really has been of interest. I've collected probably, between my partner and I, we've collected about 80 samples. And the majority, and I'm talking probably 85% of people, are either lower than normal or within within normal limits, but on the very low end of normal, which I find quite interesting. Being in South Florida and so close to the equator, I would expected to have either normal levels or high normal levels. So, and these are in exclusively MS patients. So MRI activity, it's been speculated, may vary with seasons, being that in the winter you may see more MRI activity and less in the summer. So what should you do? Well, definitely you want to ask your healthcare provider. Next time if you're on certainly if you're on interferons, you're getting blood tests done a couple times a year. And so it wouldn't be unreasonable to ask if you could have a vitamin D level added to your blood work. And although there hasn't been a consensus statement put out yet about what are the recommended supplement levels, we do know that if the levels are below 40, we recommend supplementing. So I generally will always check before I supplement somebody, only from the respect that high supplementation levels can lead to kidney stones, and that certainly isn't fun. So you don't want to just supplement kind of without taking a blood test or having any sense of where you are to begin with. So it's just recommended just to run it past your healthcare provider whether they could just add it. It's a 25 hydroxy vitamin D level to your next blood work. Vitamin B12. This is actually, B12 deficiencies are mimickers of MS. So when we're doing a diagnostic workup, we'll actually check a B12 level and a methylmalonic acid level, or abbreviation is MMA. And that's a more sensitive metabolite of B12, because if somebody's deficient in B12, they can actually have lesions show up on their spinal cord, and they can actually experience numbness and tingling, and it can look very much like MS. So the nice thing is, though, is if you have vitamin B12 deficiency, aside from being anemic, we can easily supplement this with injectable B12, and that can actually improve the symptoms greatly. So it's important that you have a B12 level checked. Certainly at the time of diagnosis, that should have been ruled out as potentially a mimicking, possible disease mimicker, or you might want to just get it checked once a year just to make sure that you're not experiencing any B12 deficiencies. Certainly can make you more tired, as well as make your sensory symptoms a little bit more severe. Vitamin E is also a fat-soluble vitamin, and just to remind you, vitamins A, D, E, and K are all the fat-soluble vitamins. So if you have big weight fluctuations, meaning if you lose a lot of weight or you gain a lot of weight, you can see some changes in your levels of those vitamins, and that you can have actually deficiencies because of that. So it does have some antioxidant properties. We know vitamin E is very helpful in healing, especially skin wounds, and might be important to take a supplement, especially if you're taking very large doses of omega-3 and omega-6 fatty acids. Tends to deplete the vitamin E. Okay, low-dose naltrexone. This is, it's interesting. Regionally, where I go, I didn't have a lot of people on this in my practice in North Carolina. Then I had a few in New York, and down here there seems to be lots of people down here on it. But in any event, naltrexone is an opioid antagonist, and we actually use it specifically for people who are addicted to opioids and alcohol to try to get them off of those. It's prescribed also for cancer, HIV, Parkinson's, MS, Alzheimer's, ALS, and autoimmune diseases off-label. And it did have a clinical trial was set up for Crohn's disease that did show some benefit. And there was actually a study that was done, I believe 2008 at UCSF. It was an 8-week study, and it was low-dose naltrexone versus placebo. And they were looking for improvements in quality of life. And what they did find in that study was that there was significant improvements in mental health, in pain, and self-reported cognitive changes. But there was no impact seen on fatigue levels, bowel or bladder control, or visual impairments, or sexual satisfaction. So it does have its place, and has been studied in conjunction with glutamate acetate or Copaxone. And so I certainly will use it if somebody wants to try it, you know, and they tolerate it, and we see if we have any improvement in those parameters. Again, specifically in mental health, meaning kind of their mood or outlook on life, pain, or self-reported cognition. Sorry, there's just a little delay here. Okay, and cannabis. So legally, some states you can actually now prescribe cannabis. Florida is definitely not one of those states, nor there aren't actually a lot of states on the East Coast. There's a few, more so on the West Coast. There has been a spray, it's called Sativex. I'm sure some of you have heard of it, that was actually approved in Canada by the Regulatory Health Board there for pain and MS. And certainly there's medications, Marinol is another medication that's used for patients with cancer to help stimulate their appetite. But it is a central nervous system depressant, may help with pain associated with spasticity and numbness and tingling, but it's not widely available or prescribed in MS, really because of state to state regulatory laws. There are pharmacies in which you can receive a prescription and purchase it under prescription in Colorado and California, and certainly other states as well. But those of us who live in states where it's not legal, we're confined to legal parameters that I can't obviously prescribe it or recommend it. The one thing I will say that I say to all my patients is that obviously this is an herb that is widely available in a non-prescriptive fashion. And I always caution people that your street pharmacist, is looking to capitalize and may not always give you the purest form of the herb. So I do often recommend just be cautious. You're not always getting what you think you're getting, so be careful. Things that we know are possibly harmful, and this is important. Oops, I'm sorry. Okay, so things that herbs, minerals, vitamins, tinctures, potions, things that purport to be immune stimulating or immune boosting. Be careful, okay? There are herbs, especially echinacea. A lot of people take these things during flu season because they want to thwart off a flu or a cold. Be careful. Large doses of vitamin C, selenium, zinc. People love to take airborne when they're on a plane. You can go to Jamba Juice and pay a couple bucks extra to have immune boost powder put into your smoothie. These are things that you don't need, okay? We don't need to boost or enhance the immune system any more so than it already is. The one upshot, okay, if we can find one silver lining in having MS, is that generally people don't get sick. It's because their immune systems are overly active. The thing is, we don't want to overstimulate that. When we give you the medications, the injectable medications and the FDA disease-modifying therapies, we're actually modifying your immune system back toward normal. Okay, we're not suppressing your immune system, but we're trying to bring it back toward normal. If you're taking things that really stimulate or boost your immune system, we don't know that it interacts with the disease-modifying therapies, but we know that we're going against what we're trying to achieve in the first place by trying to calm the immune system a little bit. So again, anything that purports to boost or enhance the immune system, just be cautious. Talk to your healthcare provider about it, your MS specialist about it, before you take it. Okay. And bee sting therapy, possibly harmful in the respect that some people are terribly allergic to bee venom and can actually have an anaphylactic reaction. And unfortunately, the first time you take bee venom, you may not have a reaction because it takes a couple of times being exposed to it before your body develops an antibody. So we often be cautious. There's also, bee sting therapy. Before the disease-modifying therapies were available, a lot of people were trying this, seeing if there was any possible benefits. There was a study that was done. It was 24 weeks long, which is a relatively short study, but it showed no reduction in disease activity, disability, or fatigue, and no improvement in quality of life. So we really feel that it's not beneficial for arresting disease progression, and actually can be possibly harmful, in fact fatal. Things that we know are definitely harmful and things that you absolutely should avoid are really the following. Cigarette smoking. Okay, so if there aren't enough reasons out there already as to why you should not be smoking, here's another one. So there were a couple of studies that were done and published in very reputable journals, and looking at smoking in MS. And it's unfortunate, but smokers are almost twice as likely to develop MS than those folks who don't smoke. And if you do smoke and you have MS, you actually progress far more rapidly than if you don't smoke. Okay, and on average, you progress 5 to 10 years faster into a progressive phase of the disease than if you don't smoke at all. Okay, and there's no evidence, though, that shows that MS might be improved by stopping smoking. Okay, and you say, well, wait, Jen, that doesn't make any sense. Well, the damage may already be done from an MS standpoint. However, we do know if you stop smoking, your lung function improves significantly. Your fatigue levels will improve because your circulation improves. Smoking causes vasoconstriction. It shuts down all of the blood vessels, making you at higher risk for stroke, higher risk for coronary artery disease, and heart attack. So, we want you to live long and live well. And cigarette smoking certainly will not contribute to any of those positive ways of life. Things that you really need to be cautious and that are actually dangerous for MS, but just in general. Be cautious with the following. Okay, ephedra I'm going to point out because ephedra, a lot of people will take diet stimulants and supplements and things to help improve their fatigue levels in MS. And ephedra is one of those things where it has a lot of different names, and it can be still on the market. Most of ephedra things were taken off when it was found to be harmful with fen-phen. But there is still ephedra components in some of the diet supplements that are not regulated. And it might come out looking things like mawang root, proprietary blend, and they list several things. And you just need to be cautious because ephedra can cause heart palpitations. It can cause, it's been linked to cardiac, to heart attacks. So be careful. Okay. Geranium also can cause kidney failure and death, and skullcap can cause severe liver damage. So there are a few resources to look at the different things that you may come across. One of the websites is the Alternative Medicine website, and this is MS relevant information. They have more than 40 therapies, actually a lot more now. And they do have a forum for you to be able to ask questions. They have newsletters and surveys that come out, and the website is there. The other, and I will make sure you guys get this when Maureen sends out the decks tomorrow, is, as I said before, the National Center for Complementary and Alternative Medicine. And that is, if you have pens handy, it's www.N as in Nancy, C as in cat, C as in cat, A, M as in money, .N as in Nancy, IH.gov. And we'll send that out tomorrow too. Another great book is by Dr. Alan Bowling. And this is really kind of, in MS, those of us who are specialists, this is kind of our go-to CAM Bible. And Dr. Bowling has done extensive work and research at different herbs and supplements and tinctures, and has them very nicely referenced in this book. And you can get a very inexpensive copy off of Amazon. Get a used copy. It will run you probably $2 or $3. But it's something great to have, especially if you're in a health food store and you want to have a reference. This is a great book for that. The Rocky Mountain MS Center also has a nice site too. So MS is not all about taking something, okay? And I hope, switching gears a little bit, we're going to move into talking about wellness too, because the whole idea of going to complementary and alternative medicine is because we know conventional medicine doesn't do everything. But you can still obtain health and experience wellness despite having a chronic illness. And because you have a chronic illness does not mean that you have to be chronically ill. Okay, and I know that seems like a paradox, but it's not. In MS, especially in relapsing forms, there are times when you may feel close to normal or normal. And those are the times where we always want you to work with you to achieve health and wellness, despite having a label of chronic illness. We want you to really think beyond your MS, and I really work with my patients as they're partners with me in this. And sometimes I feel like I try to be their health coach. But the idea is that you are the expert in your body. No one will ever know your body the way you do. And that is incredibly important information to me as a healthcare provider. And so when you come to the office, it's important we sit down and we kind of work through this together. The idea is that I want to help promote as much wellness and quality of life as I can, and give you the tools to prevent any further disease or ill feelings that you have, not only from this disease but potentially others that we can come across if we're not living well. The idea is we want to focus on balance. Extreme anything is something usually people will rapidly burn out from. So when we look at dimensions of wellness, and there are a few, we'll break them down into kind of different domains. First being the physical. There are definitely things that you have full control over. And in a disease where you often feel that you don't have a lot of control, I think it's important to focus on the things that we are capable of controlling and capable of focusing on that will contribute to your well-being and your health. The idea of nutrition is really to try to eat clean. Okay, and what I mean by that is you want to try to avoid the packaged and the preserved foods. There has been no one diet that's been found to be highly beneficial in MS. There's, of course, the Swank diet, which it does have its benefits in this respect that 95% of the patients that went to Dr. Swank reported feeling better. It was an extremely low-fat diet, but we know that diets high in sugar, high in fat, high in cholesterol are going to make you tired and sluggish and generally not feel well. So we recommend that you drink lots of water. You try to limit your amount of caffeine if possible, and that generally if you shop the perimeter of the grocery store and eat local as much as possible and organic as much as possible, generally speaking, people start to feel better. We want you exercising regularly, and exercise comes in many different forms, and people are able to achieve very different levels. And the idea is, what I tell my folks that come to see me is this, is that if you do a little more today than you did yesterday, the idea is that we're going to change your lifestyle, and that I'm not asking you to do things that I don't think you're capable of. I'm just asking you to do a little more today than you did yesterday. And if tomorrow you did a little more than you did today, we're going to be on a good track, because you're always going to be working towards building and establishing a healthier lifestyle. Make sure you sleep. It's the most powerful medicine that I could prescribe. This is the time when your body does all of its restoration and repair. I often make the analogy that sleep is like a grocery store at nights when everybody restocks the shelves and replenishes all of the goods, and that's what your body does when you sleep. When you hibernate, that's when your body's doing all of its repair and restoration, and it's incredibly important. Spirituality, we don't talk a lot about this, unfortunately, in the clinic because it's the issue of time, but I think it's very important that you walk away knowing, and this is really for everybody, that there's a purpose to your life, that there's a greater sense of why you're here. And that's not always about me in the sense of, why we're here isn't always about what you want and your day-to-day things. It's really encompasses more of who your friends are, who your family is, what's your religious persuasion, and really who are you in the face of this. Instead of asking yourself, why me? What about asking, who am I in the face of this? What goals and dreams and aspirations and gifts do you have that are going to get you through this? We want to continue striving to have intellectual growth, to continue to learn and to be able to achieve new challenges, and to recognize perspective. I think it's important to be able to get a sense of where you are and know that, unfortunately there's probably going to be someone who's always worse off than you, but there's somebody always better off than you, but there's also probably people who are worse off than you. And knowing that you have the power to affect others around you, and that can be either positive or negative. It really depends on you, and it's a choice. It's important to identify the emotional components of wellness. That stress, we know, can make people feel a whole lot worse. Doesn't seem to have an identifiably positive or negative impact on MS in the sense that looking at stress, we haven't been able to show that stress causes more relapses, but certainly makes people feel a lot worse. And if you have a lot less reserve in the first place to deal with stress, you're going to be down and out far easier than somebody who's not dealing with a chronic illness on a day-to-day basis. You want to be able to see your limitations and not necessarily embrace them, but just know what they are, but focus on what you can do and what you're capable of. If you do struggle, it's okay, and know that we can try to adopt healthy coping mechanisms and express your feelings respectfully. I think it's vitally important that you don't live life in a vacuum, that you have intimacy and you have family relationships and friendships, and that there's some community outreach. The best way to feel better about yourself is to do something for someone else. So really wrapping things up, we want to utilize all the therapies, those being medically conventional, unconventional, alternative, integrative or complementary, but things that add to your quality of life and not detract from it. And the one thing, if I can impart, is that to please discuss it with your healthcare provider, and I like to say healthcare partner, because I hope that with the person that you work with who's an MS specialist, and you are an MS specialist as well. As I said, you're an expert. We may have a knowledge in the science, but you have the most important knowledge, which is that of yourself. And to take that and discuss that with your healthcare provider, it's vitally important to initiate and instigate that discussion if it hasn't been held already. So I'm going to turn it back over to Maureen and see if there are any questions. But I thank you so much for your time and your attention. And I know ran a little longer than we expected, but I'd be happy to take any questions.
Great. Thanks so much, Jen. That was a great presentation. We do have a few questions. We have time for a few of them. A couple of people kind of have similar questions, so I'll just sort of consolidate them. One participant asks, does secondhand smoke increase the likeliness of getting MS?
So that's an excellent question. So there hasn't been, actually, you know what, I want to say recently there was something published. I think there was something mentioned a couple of weeks ago. I just can't cite the source offhand, but secondhand smoke we know is very, in general, is can cause problems with lung cancer in individuals who are not affected with MS. And so generally I would say if you live with a smoker, I would encourage them, and sometimes it's okay by me to pull out the guilt trip because it's your health. And so secondhand smoke, uniformly I can say, is not good. And I'm sorry, I don't have it at my fingertips, the citation, but I believe there was something recently published about secondhand smoke in MS. And I will, and I'll look it up, and if I get that information, I will give it to Maureen, and she can disseminate it tomorrow with the other information that wasn't available in the webcast. But I'm sorry I don't have it right at my fingertips.
No, that's great. Just good information to have. Another question is, how do I know which vitamins are checked out by the government, I think meaning that are okay to take?
So if you go on the website, the National Center for CAMS, for Complementary and Alternative Medicine and MS, they generally have a listing of what's okay to take, what's been regulated. Also, the other website I gave you, the MS CAM, would show what's okay to take in MS, and certainly Dr. Bowling's book is very, very good reference. But generally, just for an overview of what's been kind of regulated by the FDA, you can go to the NIH website. Great.
And I'll kind of combine these two questions. One person asks about evidence of benefits of massage regarding MS, and the other one asks about chiropractors.
Okay, so both of these questions, if you go to the National MS Society website, they actually have very good pages on both of these. And so there wasn't, massage therapy has been studied in different types of massage. So there are several types. And certainly there are benefits. Massage has been very helpful in pain relief with MS and with spasticity and with poor circulation. The only things that you have to be cautious of is that you want to be careful if you have edema, or swelling of your legs, okay, because if you have lymph drainage issues because of what we call dependent edema or dependent swelling, you do want to be cautious and have that looked at by your healthcare provider first before you do any type of massage. Also, if you have any liver enlargement or spleen enlargement, you would want to be cautious. And if you're pregnant, obviously you want to have that discussed with your healthcare, your gynecologist or your obstetrician prior. But there was a study in 1998 that was done looking at massage in people with MS, and it did show that it was a 5-week study, and people did have improvement in their physical and social activity with receiving massage. And those people in the report, in the group that received massage, also reported a decrease in depression, but they didn't have any improvement in grip strength. That was one of the things they tested, and they didn't show real significant improvement in their walking ability. But they certainly saw a relief in their anxiety and their depression. They had an improvement in their mood and body image, and increased a decrease in depression, rather. And chiropractic, there hasn't been any evidence to show that chiropractic actually prevents disease progression, although it's seemingly helpful with low back pain. And generally you want to give it at least a 6-week period before you determine if it's beneficial or not. And generally what they'll do, a chiropractor will assess first the entire spinal column, and then sometimes they'll do radiographic imaging, like x-rays, and determine if readjustment or alignments will be helpful. The idea that chiropractic is, you're readjusting the vertebral column to decrease pressure off of nerves, but they're really dealing with more peripheral nerve the pathways as opposed to central nerve pathways. Remember, MS affects really the brain, the spinal cord, and the optic nerves, where chiropractic seems to be more effective in relieving pain from nerve compression of peripheral nerves.
Great, thanks, Jen. And last question, I'll kind of combine a few of these two. I know you touched on this, but maybe just a clarification. What is the average dose of vitamin D recommended for someone with MS?
Oh, so that's a loaded question. It's a good one. But so there isn't, as I said before, there's not a consensus. I've heard as high as 50,000 units, 10,000 units, 2,000 units, 5,000 units. It really depends on the person's baseline vitamin D level. In my practice, I'll tell you, if somebody is within normal limits or on the low side of normal, I'll recommend that they take about 2,000 international units a day. If somebody's low, I will dose them for 5,000 units for 1 month, then recheck their level, and dependent on what that is, I may continue for another month at 5,000 or then put them on 2,000. But again, this really isn't rooted in any hard evidence. It's based on kind of just discussion amongst peers about what we're all doing. But I've heard very high doses. I mean, 50,000 and the 10,000 units. I've even heard intravenously, supplementation done. You just have to be very cautious because people can develop, as I said, kidney stones. And again, the idea is that we do no harm. So I would advise whomever asked the question to just follow up and make sure you talk to your healthcare provider, either your primary care doctor or even your MS specialist, and get a baseline lab first before you supplement.
Great. Thanks so much, Jen. And do you have any closing words before we sign off tonight?
I just want to, again, thank everybody. I know this is a really busy time of year, and certainly with everything that's going on this week in the world, I just wanted to say thanks so much. And also I see one of my friends is on the list. I just want to give a quick shout out to Gail and tell you to catch up with Nancy Grace. Talk to you soon.
Great. Thanks again, everyone, for tuning in tonight. We're excited about our next webinar, April 12th, Stress Management with Alice Chaddy, and you can register for that on our website at mscando.org. And for those participating live tonight, as soon as this presentation is over, you will see a survey appear on your computer screen. So please take a moment to complete the survey and help us continue to improve our webinars. We value your feedback and input. So thanks again. Have a great night.